Atelectasis. Atelectasis is collapse of lung tissue with loss of volume. The natural tendency for open air spaces such as the alveoli to collapse is countered by first surfactant, which maintains surface tension. The other is continuous breathing, which keeps the alveolus open, and intermittent deep breathing, which releases surfactant into the alveoli. And also periodic coughing, which clears the airway of secretion, is important to keep the airway patent. Major consequences of atelectasis includes underventilation with hypoxia and ventilation perfusion mismatch and complication as pneumonia. This is the types and the causes of atelectasis. There are three main types of atelectasis. The first one is resorptive or obstructive atelectasis. This happens when the oxygen and the carbon dioxide in alveoli move into the bloodstream and then no new air moves in, which causes alveolus to collapse. Surgery that requires anesthesia is a common cause of resorptive atelectasis. Something blocking the inside of your lung, keeping air from coming into the alveolus, can also cause resorptive atelectasis. The blockage can be mucus, a tumor, or an object that can be accidentally inhaled. The second is compressive atelectasis. This is when something around the lung, like fluid, air, blood, or tumor, pushes against it, causing it to collapse. The other is contraction atelectasis. In this case, lung scarring or fibrosis causes contraction atelectasis. Scarring keeps the alveolus from opening properly. When we see symptoms and the signs of atelectasis, atelectasis itself is asymptomatic unless hypoxemia or pneumonia develops. Symptoms of hypoxemia tend to be related to acute and extent of atelectasis. With rapid, extensive atelectasis, dyspnea or even respiratory failure can develop. With slowly developing, less extensive atelectasis, symptoms may be mild or absent. Pneumonia may cause cough, dyspnea, and pleuritic pain. But pleuritic pain may also be due to the disorders that cause the atelectasis, such as chest trauma or surgery. Signs are often absent. If the area of atelectasis is large, decreased breath sound in the region of atelectasis, possible dullness to percussion, and a decreased chest excursion are detectable. Often, it is discovered only on chest imaging. When we see the diagnosis of atelectasis, chest X-ray is the most important thing to do. On chest X-ray, finding can include lung opacification and the loss of lung volume. If the cause of atelectasis is not clinically apparent, for example, if it is not recent surgery or pneumonia is not identified on chest X-ray, or another disorder is suspected, such as embolism or tumor, bronchoscopy or chest CT can be done. Let's see the treatment of atelectasis. If obstruction by tumor or foreign body is suspected, bronchoscopy is must. Commonly recommended measures include chest physiotherapy to help maintain ventilation and the clearance of secretion, encouragement of lung expansion techniques such as direct coughing, deep breathing exercise, and the use of incentive spirometry. In ambulatory patients, exercise such as walking is a desirable way to promote deep breathing. For patients who are not intubated and they do not have excessive secretion, continuous positive airway pressure or CPAP is helpful. For patients who are intubated and mechanically ventilated, positive end-expiratory pressure and higher tidal volume ventilation may help. Avoiding oversedation helps ensures ventilation and sufficient deep breathing and coughing. However, severe pleuritic pain may impair deep breathing and coughing and might be relieved only with opioids. Most importantly, the cause of atelectasis should be treated. Mucus plug, foreign body, tumor, mass, effusion, anything that causes atelectasis should be treated. For persistent mucus plugging, sometimes bronchodilators are tried. If other measures are ineffective or if a cause of obstruction other than mucus plugging is suspected, bronchoscopy should be done. After surgery, air deambulation and the lung expansion techniques by coughing, deep breathing exercise, and the incentive spirometry might also decrease risk. Thank you for watching.